Hi everyone, I am Maria Cristela and today we are going to talk about a condition that's often silent but dangerous. It's called abdominal aortic aneurysm, or AAA for short. This condition affects thousands of people, especially older adults, and knowing it can actually save a life. So let's break it down in a way that's easy to understand. What is an abdominal aortic aneurysm? Your heart pumps blood through a big blood vessel called the aorta, like a highway that carries blood to the rest of your body. Part of this highway runs through your belly. The aorta is the largest artery in the body. It carries oxygen-rich blood away from the left ventricle throughout the body. The aorta can be divided into four sections: the ascending aorta, the aortic arch, the thoracic or descending aorta, and abdominal aorta. The aorta comprises a thin inner layer called the intima, a thick elastic middle layer called the media, and a thin outer layer called the adventitia. These layers allow the aorta to absorb the force of the blood as it is pumped from the heart to the rest of the body. When the aorta weakens, a balloon-like bulge called an aneurysm can develop. They can happen at any point along the aorta. Aortic aneurysm can dissect or rupture. The force of blood pumping can split the layers of the artery wall, allowing blood to leak in between the intima and media layer. This process is called a dissection. As a result, a septum forms and separates the true lumen from the newly created false lumen. The aneurysm can also burst completely, causing bleeding inside the body. This is called a rupture and is a surgical emergency in which 85% of patients die, and 66% of these deaths occur before reaching the hospital. The key symptom of this is a sudden severe tearing pain in your chest or upper back. Surgeons usually recommend surgery before the aneurysm ruptures. AAA usually glows slowly and doesn't cause symptoms at first, which is why it's known as silent killer. What causes it and who's at risk? AAA tends to develop due to the weakening of arterial walls. Common risk factors include aging, which is more common in men over 65 years old. Second is smoking, which is biggest and modifiable risk. Third is high blood pressure, which increases the pressure on artery walls. Fourth is family history. Genetics can play a vital role. Fifth is high cholesterol, which leads to artery damage over time. Imagine your aorta like a rubber hose. Over the years, wear and tear, pressure, and unhealthy habits can stretch it out, causing it to bulge and weaken. How is AAA diagnosed? Most AAAs are found by accident during tests for other issues like ultrasounds or CT scan. But there are screening programs especially for older men or those with a history of smoking to catch it early before it becomes dangerous. Early detection is key to preventing rupture. Here are the NANDA nursing diagnosis. One applicable NANDA diagnosis for AAA is risk for ineffective tissue perfusion and abdominal related to weakened arterial wall as evidenced by the presence of aneurysm. What does that mean? It means that there's a risk that abdominal organs may not get enough blood because the vessel that supplies them is weakened and could rupture. And our job as healthcare providers is to monitor, educate, and prepare the patients. Here are the three major nursing interventions. First is to monitor vital signs and assess for symptoms. Regularly check blood pressure, pulse, and abdominal girth. Watch for warning signs, which is sudden abdominal or back pain, drop in blood pressure, or dizziness, and if these show up, treat it as an emergency. Second is to educate the patient on lifestyle changes. First is stop smoking, as it directly weakens arteries. Second is to encourage a low-fat, low-sodium diet to control blood pressure and cholesterol. Promote moderate exercise for circulation and heart health. Third is to prepare and educate for possible surgery. If the aneurysm is large, about greater than 5.5 cm, then surgery may be needed. There are actually two main types. First is the open surgical repair, which is more invasive, and then we have the EVAR, which is endovascular aneurysm repair, which is minimally invasive. And as nurses, we help patients understand their options, ease their anxiety, and get ready for procedures. AAA is a serious, but early detection saves lives. Know the risk factors, especially in older men and smokers. Encourage screening, healthy habits, and regular monitoring. If you or your loved one is at risk, talk to your healthcare provider about getting screened, and you might just save a life. Thank you for watching this video, and I hope you learned as much as I did. Thank you.